Good morning. This is the second part of the quality training, or actually it's not quality training, it's HR, staff qualification and education, your way of job mastery. So it's HR training. Please write HR training. HR training, then write the topic. Write your name, write the date. The trainer is me. Before starting, I have to fix the logistic thing. Write your name, please. Write the name of the trainer. Write the HR training. And now write your way of job mastery. This is part 2. And today I will tell you 4 reasons that prevents you from building your learning curve and learning skills. We start for last time for the discussing the basic pyramid of obtaining any skill. Start with knowledge, then it create. This knowledge will create some beliefs, and these beliefs will initiate your skills. Okay? And I'm trying to apply this into our practice, but the new thing today is, yes, there is other barriers that prevents you from the start to start even this pyramid. So drawing number 1, please draw this. Pyramid of obtaining skills. Write it again, please. Write and draw the pyramid, please. And make its legend or its title. Pyramid of obtaining skills. Okay. If it is that easy, why not everyone is able to gain or maintain his skills? Only 10%, 10 to 12% of our population are considered skillful guys. So if it is that easy, why we are not able to do it? Is it a problem of knowledge? If there is a scarce knowledge? If there is a problem on beliefs or religions, or if is it a problem of practice? Not yet. So scientists are telling you the 4 reasons for not gaining any progress and losing your acquired skills. It's another different pyramid with different reasons. Number 1, is it stupidness? You are not able to achieve skills. Is it because of you are stupid? You are monkey? What is science telling us? Science telling us it is less than 3% of populations, only 3%, the 5 sigma, are geniuses, real geniuses, or real stupid. Okay, so having a staff of 44 here, I don't think we have that much stupidness. This is as per scientists. Stupidity with low IQ, low analytical IQ. The definition of stupidness is, no, it is not. It is not, but it is there, it counts. But is it laziness? Is it because you are calorie saving mood, as my colleague here said? Or boredom? Well, all human cannot be lazy. You cannot be lazy. You are a biological creature. You cannot be lazy, even if you intended to be more than 17% of your time. So definitely, cause number 2 is only responsible for your being lazy, or the calorie receiving mood cannot be more than 1/5 of your cause. Okay? So please عاوزك تكتب يا إبراهيم من فضلك causes. Number 1, stupidness. Causes of losing skills. Please, I need something to be written, please. Causes of losing skills. Number 1, stupidity or low IQ. Arrogance. Me, I'll be student again. Me, I will write like a student again, ya Ashraf. I will write my name and I do paperwork. So this is arrogance is an instinct sexual behavior of feeling, not being, of feeling clever more than the others. And sadly, here will lie 33% of your stupidness in learning, not the stupidness by the meaning of low IQ. You are so arrogant to learn from your colleague how he's doing smooth finishing lines. You are so arrogant not to learn from the lady that's taking the card every week how to deal with patient. No. I'm definitely better than her. So later, you are so arrogant not to accept shouting of your mentor or your boss teaching you something because he's wacko, he's grudgy. No, I am better than him. So sadly, 33% of you are not able to learn, and you're going to be poor. You're not going to be skillful because you are arrogant. You think that I'm good. You think it does not worthy to go back to be a student again. So this is cause number 3. Arrogancy. Cause number 4, it's embarrassment. You are embarrassed by your psychological or school bullying or psychological stresses or traumas in your school to be embarrassed. You feel like this. When I'm going to screw up, when I'm making the CBCT or making a bad coding or making a bad email, that your trauma, your feeling that you're going to be bullied, everyone going to ha, she did the wrong prescription. The feeling of embarrassment might make you not able to even to start doing, because you will never do prescriptions without doing mistakes. I told you my funny mistake when the first time 10 years ago, Voltaren, because it was very strong on stomach, so they cannot exceed 50 milligrams. So it was the first time because I'm trying to be a student, I was updating myself and knew that Voltaren 75 SR slow release is being released in the market as a tablet. Okay? So I'm talking about a prescription and why it's okay to be embarrassed in front of the staff, because you have to do mistakes. And now I'm telling my mistake for the Voltaren 75 tablet. For a long time, for 10 years before, 75 milligram dose was only for suppository. Okay? So my nurse, for the first time, and I signed it, I did not see it. We signed for our patient for 5 days after impaction, twice a day suppository for treatment of impaction, oral surgery. And I didn't notice until the patient came to me in the suture removal, or I think in the second irrigation. How you say, any pain? No pain at all. But strange question, doctor, suppository? It was okay, but it's a little bit strange. So I hide it and I told them, yeah, this is a new invention and blah, 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 blah. So yes, I wrote a suppository for my patients twice a day for 5 days by mistake. Of course, I'm not taking this, it's Very dangerous to make mistakes in prescription, but don't be embarrassed. Don't feel that the psychological trauma, everyone have been bullied. It's not that trauma. It's what we call it post-trauma stresses. This guy has trauma. Everyone has traumas in his life. The problem is not the trauma. The problem is post-trauma stress syndrome. It's well known. So, yeah, feeling of recall childhood traumas with its post-traumatic disturbance. You have a feeling that if you're gonna make a CBCT in a wrong way, and your colleagues start bullying you, which they might do, by the way, this will prevent you. This will prevent you from doing forward. To sum up, the causes of preventing you from gaining skills, this is the take message home, please. Stupidity, which is rare. Laziness, which is half-half. 20% of the causes, yes, you are lazy. Arrogance, which is the most important, which is arrogance, as I mentioned, learning to colleague how to do a surgery, or learning from the lab technician how to design a case, learning from colleague how to manage smooth booking, learning from the net how to plan for your workflow, or learning and reading what is a CBCT and how to do a CBCT. And embarrassment from colleagues, from bosses. Yeah, a very stupid sentence, usually Kabayan say it. When I ask them when they screwed up, being arrogant or being lazy or being embarrassed, to avoid embarrassment, did you send the email? Not yet. As if she was just sending it, but I asked her very early. It's yes or no. So when we ask you to treat yourself from the arrogancy and from feeling of being embarrassed, please use a yes or no. And from juniors, so sadly I have left out of this 33 plus 33 plus 17 plus 3, I have out of this stuff standing in front of me only 12%. Only 12% are prone to continue with vision dental clinic unless you changed. Type some tips and tricks to start your expert learning career. Please start now. Please start now. And actually we started last week, and I give you topics to start teaching yourself. Know your enemies. Know your enemies of learning, the four enemies, and which I will add another tip here. One of the fifth enemy is financial compensation. Financial compensation, meaning, if I told you, if you make this CBCT, I'm gonna give you immediately 1,000 dirhams. You're gonna, even if your colleague gonna bully you, yeah. Even you're gonna feel humbled, yes. If you are really, really lazy and you want to sleep, yes. But sadly, life is not like this. Money is not that fast. So of course, the financial reward is one of your motivators, and please, it is not that soon. If you learn the framework, Asma, it's not gonna fix 1,000 dirham immediately. It will improve your salary after 10 years by 3,000 dirhams every month. So actually, these are the 5 social axes. The 5 social axes: stupidness, IQ, laziness, arrogance, embarrassment, financial rewarding. Another tip: your boss is not your enemy. This was a long lecture of No, the boss of Microsoft. Bill Gates, Bill Gates, Bill Gates. I mix it between Steve Jobs and Bill Gates. There is a very famous lecture for Bill Gates about 10 secrets required by your boss. You will not be taught in university. One of these, your boss does not like you, okay, but in 80% of the cases, okay, yes, there of course there is psychological bosses. I may say, but there is something, delivery or something, or government. Looks like a government. So in 80% of cases, your boss does not hate you. He shouts you, but he does not wait. Definitely he loves his work more than you. Yes, there is 20% psychopath, but we are talking about the general. Please go for learning, not on a knowledge. We described this last. Don't go for the hearsay. Don't go for the media threads. Don't go for trial and errors. Expert in one expert or focus يعني in one thing at a time. Focus in one thing at a time. Focus in triage. Focus in assistant. Focus in root canal. Focus in I started my private career here by focusing on scaling. I took a 2 days course in the Swiss Periodontology Association, Swiss Association of Periodontology, just to know them 10 years ago, that every standard is to start with the profi before the scaling. So when I started my career here as a private general practitioner, I start focusing not on the frameworks. I start focusing in some small thing one by one. Okay, I finished my my presentation. Now I'm gonna test it, and this is you received this on communication, or I don't know. So I will pick three staff today to talk about their guidelines. I will start. Pick a topic that you wrote 3 topics last.
Yes, it's about how to overcome difficulties from inventory and purchase.
Nice topic. What is? Give us the main threads you're gonna speak about. Did you do your homework?
Yes, doctor.
Okay.
Can I just take a...
Okay. It's not a presentation. We just need glimpse.
Yeah, yes. One is to identify the challenges that I'm struggling with.
Like?
Managing the stocks
Okay.
just properly, and then ordering or managing also how to take the approvals from the management. So I'm trying to manage my time with dispatching and contacting the suppliers like that.
Looks good. You're talking about storing.
Yeah,
Did you
storing.
reach FIFO? Not yet.
Yeah, I'm reaching FIFO for now, doctor. Whatever.
What is FIFO? Tell the staff. What is FIFO?
FIFO, it's first in, first out. So like that. So
So-
whatever I receive first, I'm gonna dispatching first it to you before it's expired. So this is the main thing. And then if there is non-moving things also, I'm pushing these items to be released on the clearing. So at least we will not throw it.
Nice. Are you ready today to give it to the HR? This 10 to 12 presentation?
Yes, doctor, it's there already.
Thank you.
Thank you, doctor.
Another colleague. Let's go for Dr. Ammar. Any idea? One topic, 3 fundamentals.
My topic this week was a small guideline to dental photography. So what I mentioned were what you require, first of all, as equipment for dental photography. Secondly, what are the 3 main factors involved in dental photography? And the third part was positioning yourself when you're taking dental photography.
Thank you. طيب third volunteer. Third volunteer. يلا I need to go to my work. Third volunteer. Volunteer. Volunteer with a blue card. Blue card. Blue card. Blue card. I will pick without anything, so يلا. Whatever you're gonna say, we appreciate. Topic 3 fundamentals.
Okay, so basically, my duty as a dental assistant.
We are not talking about the duty, we are talking about the learning 3 lectures. Which?
My duty is on post-op instructions after sinus lifting.
Post-operative instructions after sinus lifting. Okay, what is the 3 fundamentals?
The fundamentals is like how do we inform the patient regarding the surgery, like pre-op instructions and the post-op instructions, and regarding the surgery.
So you took even pre,
Yeah.
the educational brochure.
Yes.
طيب, looks okay.
Yes. So basically, when I'm dealing with patients, like I need to inform them regarding the post-op instructions, how they need to take care, because that's the most essential part post-surgery. Like if in case there is like a sinus lift, they're not supposed to
Sneeze or smoke.
They're not supposed to smoke. They're not supposed to blow and not use straws or something.
Nice.
That
What was your reference? One of your reference? Give us example of your references in preparation.
references I took from our patients as like we had.
No. Reference of writing the presentation.
I use SlideShare.
SlideShare.
Yes.
طيب, okay. طيب, thank you. طيب, I will announce that there is going to be editors. So please, the coordinator, of course, the Marife. I will assign Dr. Ammar as the editor for the medical part, and Miss Heba will be the editor of the admin part. What do we editor meaning? Editor is something in writing is to help you to have a same context, same title, same format, and to be correct, to correct the information to be really used. This is not a fancy, this is not a university. I'm a private, I'm looking for profit. So we are trying to improve you and make this self-improvement also will improve the facility. Any questions? 3, 2, 1. Thank you. See you next week. Bye-bye.